Potential budget cuts have one local health organization bracing for the worst. ABC 40's Shannon Hagee tells us what those cuts would mean for the agency and the communities it serves. Shannon?
Kathy, Tapestry Health hasn't had an easy year. The organization already had to close offices in Athol, North Adams, and Great Barrington because of state budget cuts made in October. Now it could lose another 70% of its state funding, a devastating loss that would lead to some difficult decisions. People who work for Tapestry Health and the people they serve have been dealing with the cuts for months, and communities like Holyoke have felt the impact.
The other day I had somebody from our mobile clinic with symptoms of an STD, and they weren't able to get tested, so they ended up having to go to the hospital for treatment.
Without health insurance, the patient no longer had access to Tapestry Health's clinics, a result of the 16% cut in state funding. Instead, Timothy Purrington, Director of Prevention Services at Tapestry, says the patient probably had to pay around $1,000 for ER treatment. Tapestry used to be able to provide that service for a fraction of the cost.
So people that are uninsured, there's no safety net anymore.
The governor has proposed cutting Tapestry's budget by another close to $600,000 for the next fiscal year, beginning July 1st.
If this goes through, it will be very difficult for us to sustain our services. Again, we would have to make some very difficult decisions.
Decisions that could result in the closing of more offices. In Holyoke, which has the highest teen pregnancy rate in the state, Purrington says closing the clinic would be devastating.
It could mean higher births, less access for especially young people that are seeking affordable birth control.
Just last year, Tapestry provided services to more than 10,000 clients in western Massachusetts. It had to cut that number by more than 1,600 this year and will have to slash it even further by over 6,000 if these proposed budget cuts are passed. But staff members aren't giving up just yet. Suzanne Smith, Director of Health Services at Tapestry, will be spending the rest of the week in Boston to speak with legislators about how critical Tapestry services are. Dave?